Chronic knee pain affects roughly 25% of adults today, resulting in limited function, mobility, and quality of life. As the most common cause of knee pain in people over the age of 50, osteoarthritis is estimated to impact more than 360 million people worldwide.
About 1 in 4 people with aging develop pretty severe symptoms of osteoarthritis. It's a degenerative disease that occurs slowly over time. Now, another thing to look at is youth. A young person with an anterior cruciate ligament injury to the knee at 20 years old will likely have arthritis or the symptoms of arthritis by 30. So it occurs early in life too, as well. What we found is that if they have reduced quadriceps function, the disease will actually progress more rapidly. It'll be more painful.
People that have history of injury almost always develop arthritis a lot earlier in life. For example, an athlete that had a cruciate ligament injury or a meniscus injury, anything that changes the forces and the way they're distributed through the knee, the mechanics of the joint and the way that they move, those things all seem to accelerate the arthritic process in a joint.
While staying active is important both for joint health and overall well-being, it can be difficult to achieve when living with knee pain, often perpetuating a vicious cycle that can worsen the condition.
We know from research that it's actually really important both for joint health and for our overall health to maintain physical activity. Weak quadriceps have been linked to worse joint pain and disability, poor treatment outcomes, and also progression of degenerative joint disease like osteoarthritis.
People become more sedentary as a result of painful joints and arthritis. Other muscles start to atrophy. There are other effects from that, cardiovascular dysfunction, etc. And mood. So anyone that becomes more sedentary as a result of a painful joint tends to have some other systemic things that follow it, and none of those are good.
In severe cases, knee replacement surgery is used to relieve pain and regain mobility. However, older populations are at a higher risk for complications. Now more than ever, there is a need for non-invasive alternatives to traditional treatments for chronic knee pain.
Non-invasive treatments are attractive because typically they have less side effects. And the new thing is one that enhances activity by reducing pain during activity, and also enhances the use of the muscles of the knee joint when walking.
Pain medications or joint injections or surgery. These can be effective, but they can come with risks of side effects. There's also things like physical therapy, but it requires patients to actually do the exercises and be motivated to do the exercises. KneeMo is a wearable, non-invasive device that we developed to reduce knee pain during activity. It consists of 2 bands. You place one above your knee and one below your knee, and they have motion sensing technology that sense the wearer's motion patterns and then apply intermittent vibration that's specifically timed to each user's specific motion patterns. The intermittent vibration reduces pain that's traveling to the brain, so it interrupts those pain signals so that people feel less pain and can have better function while they're moving.
Developed to reduce knee pain and improve muscle function during activity, the device uses science from the gate control theory of pain to lessen the amount of painful stimulus reaching the brain.
The way this works in our body is we have sensory receptors. They take in things like touch and vibration and pressure and also pain. And they send those signals to our brain along both large and small nerve fibers. So if there's more large nerve fiber activity, it can actually block, or kind of like a traffic jam, reduce the amount of small nerve fiber activity that reaches our brain.
To really develop the algorithm and the technology, we had to first identify in the laboratory what are the key movement patterns of the knee that affect pain and the relationship between the two. We looked at putting that information into a small device that had sensors that would actually sense for that particular motion. And we programmed an algorithm that used that information and processed it to provide the vibration at the right time during movement and turn it off when it didn't need to be on.
Backed by science and clinical studies, the technology was shown in peer-reviewed clinical research to reduce knee pain and improve quadriceps muscle function during walking and navigating stairs.
We started by doing a clinical study at Stanford in patients who had knee pain due to a pathology we knew was linked to reduced quadriceps muscle function, so osteoarthritis, ACL tears, and meniscus tears. 95% of the participants in a single testing session had an increase in their quadriceps muscle function. After this, we went on to do a longitudinal randomized controlled study. So participants were assigned to wear either KneeMo or an off-the-shelf knee device that just applied pressure to the leg. They wore it for 4 weeks, then they wore no treatment for 2 weeks, and then they wore the other treatment for 4 weeks. So they wore both treatments. We saw that after 4 weeks, participants had significant improvements in pain when walking and as well as knee symptoms. We didn't see that same improvement when they wore the control device. And we also found that there was improvements in how patients navigated stairs. So going up and down stairs can be really hard when you have knee pain.
What happens is there's just a natural resistance for a lot of people to get up and be active if it hurts. And by taking away the pain when they're moving, and it's designed to take away the pain when they're moving, they're more active. And there's a benefit to being more active, not just in terms of overall knee health, but in terms of cardiovascular health, obesity, type 2 diabetes, and mental health. So it definitely has a lot of potential benefits that I think will help people.
Improved mobility and function support mental health, well-being, and quality of life, extending longevity for a happier and healthier future.